Good morning everyone, Namaste, how are you? Today we are going to learn about occupational therapy. So before I talk about occupational therapy, my name is Purnima Bhatt. I am the mother of a special son called Pratik Bhatt, and I also run a therapy center in Mangalore called Arivu Early Intervention Center. Dear friends, when you go to a doctor and the doctor diagnoses your child with special needs or hyperactivity or some slow learning problems, as parents you naturally get very worried. The doctor may tell the word, please take occupational therapy services to improve your child. So the question comes, what is occupational therapy? Occupational therapy or occupational therapist is someone who teaches your child daily living skills like sitting, holding, doing things properly, walking, running, etc. etc. The reason is, if I am a special child, I will not be holding this correctly. I'll be throwing this, or I'll be doing like this, or I'll be doing like this. The reason being is that special children do not have the skills to do things properly or to use their body parts like hands, legs, their neck, shoulders, etc. properly. Due to this, they are not able to do things like holding a spoon, opening this, or opening a box. Hence, occupational therapy is very important for your child to learn daily living skills. So today I am going to tell three major things that your occupational therapist will teach your child. Before we go on to the three things, I just want to thank you all for your support, and I request all of you to share this video and also subscribe to our channel. If you look at the details box, all the details are there. Please subscribe to our channel and make sure that these videos reach maximum children with special needs. So dear friends, the first thing an occupational therapist is going to do is to teach your child to sit in a place. Now I am sitting in a place, but a child with special needs is unable to sit in a place, or someone with autism or ADHD. They either move about, they sit like this, or they will be moving. So for that, showing them things like color like this, or a ball, colorful ball, or things will help a child to sit in a place, because color is something a child gets naturally attracted. So let's say if I give a thing like this, a child may be able to look at this and sit for a minute or two. A child may do like this, a child may do like this, because this is more of an exploring thing for a child. And once the child is able to sit with this for 1 or 2 minutes, we can increase it to 3, 4, 5, 6, 7, 8, 9, 10, and this will increase the patience, the sitting tolerance in a child. I hope I made my point clear, and I hope I have made you all understand this. The second thing that occupational therapist will teach is holding and sitting. It is not enough if a child sits in a place. A child should also know how to hold things properly. For example, like this. Holding and also like this. The child should also know how to hold things like this. Holding. See? Holding. So, this will also improve the attention span of the child. Regarding attention span, I am going to do another video. See? I am able to do. Which, if you all have a special child, you will know that your child is not able to do this properly. The third thing occupational therapist will teach your child is how to use the hands properly. For example, if I give this ball to a child, a child may use both the hands like this. That is not the right way to do. You should be using this hand for holding and this hand for removing. Or if your child is lefty, they have to hold with the right hand and remove with the left hand. For both the brains to be balanced, both the brain energies to be balanced, it is important that the child does activities with one hand and use the other hand for support or for holding. And that is what occupational therapist will teach. Doing the things correctly. And also things like this, holding a spoon, not just sitting and holding, but also using it properly. Like for example, I am sitting, holding and using it correctly. Can you all see? So we all need to understand, for a special child, all these things are very complex and complicated, and an occupational therapist will help your child to learn all these things. Thank you so much, parents. Please keep your support intact, and also drop your comments in the comments box so that we know what your thoughts are, and also please get back to us with questions again in the comments box. We are going to answer all your questions. Thank you.